Hey peeps, I just wanted to come on and talk to you really quickly about the arcuate line noted in this picture here. So what is it? The arcuate line is a horizontal line that demarcates the lower limit of the posterior layer of the rectus sheath. Superior to the arcuate line, as you see here, the internal oblique splits and goes anterior and posterior to the rectus abdominis. So you have an anterior sheath and then you have a posterior rectus sheath. Below the arcuate line, the internal oblique and the transversus abdominis aponeurosis, they all merge with the external iliac. So all three muscles merge and pass anterior to the rectus muscle. So where is the arcuate line? You saw this picture earlier, but it's about halfway between the pubic tubercle and the umbilicus here. So here you have a nice sagittal view of the arcuate line. Here it is here. Above it, anterior and posterior rectus sheath. Below it, you only have your anterior wall of the rectus sheath. And if you think about C-sections and your low transverse incisions, you only see the anterior portion of the rectus sheath. And then in your vertical midline incisions that go higher up, you can see both an anterior and posterior wall. This is also important because this is approximately where the inferior epigastric vessels perforate the rectus abdominis muscles. You might be thinking, okay, why is this important? You can have some hernias associated with this area, but the most important thing is just knowing the anatomy and the area that you're dissecting and the area you're operating in. If you know the anatomy, you can confidently get yourself out of any surgical situation, and you should know the anatomy in any space that you're operating in. So I hope this was a good reminder. Let me know if you have any questions or comments. Hope you have a great Memorial Day weekend.